With Jake, yes, even though those cameras don't show that they're on, it's picking up the microphone from the camera. Just so you know, for the person who wanted to get audio tape, it's not going to be live streamed, it's just going to be taped.
Okay, thank you for letting me
Good
know.
luck.
Okay, it's 11 a.m. Meeting to order. The meeting is being recorded. We have Michelle Piscicanto from Leicester Regional Public Health Coalition and Richard Green, right, who's our new health agent in training still, or are you?
Yeah.
Okay. Thank you. The agenda, I think we have a hard stop at 11:30 for you?
Yeah.
So there's two quick items if I want to make a motion or your motion to take the agenda out of order so that I can go through numbers 2 and 4 and then go back to 1 and 3.
Second.
The clerk position, I just want to leave you with the two, you have the copies, the two applicants that we've received. One is a neighbor of mine, so I have to recuse myself from this topic. So I've given you the resumes and you can, I can either move out and have you quickly decide how you want to move forward. Do you want to, at the next meeting, and then you can just let me know for the next meeting what to put on the agenda so that you have time to review and decide if you want to do interviews or what you need to do. Okay?
Okay.
I'm recusing myself. Just kind of hard for me.
What do you think? Do you think we need to do interviews? I mean, one is Megan. She's been with the coalition 3 years. She
Yeah.
was an intern and then she's been the admin assistant. I'm not- I mean, based on experience alone, I don't know if you want to just move forward with it. Yeah. Yeah.
Do we go through that anyway? Are we sure Megan wants to do it?
Well, she applied.
Yeah.
I don't want to waste anybody's
I know.
time. Yeah.
Yeah, she knows, she works well with Mackenzie, she already knows everybody in Leicester. She knows, yeah, and she's been awesome.
Yeah.
Really quick to respond, she's always through. I really liked working with her. Sweating, I feel like going off. Anyway.
Okay, so do we need to make a motion?
I don't know, the legalities,
Yeah.
like, I don't know the legalities of this.
That's. And then send the other applicant a response. Thank you for that one.
Yeah, well, that's offered, and she has to accept, right? And then, just have to thank you.
I don't, so it's just the candidates, but are we supposed to offer her a salary or
Isn't that discussion just to
go about the candidates? Okay.
Okay, so,
just choosing one person.
yeah,
Okay.
so we'll make the motion that we choose.
To hire Megan as
Yeah.
the
For all right, Maureen, I think we're done.
what we would do without you.
Oh, got it. So,
Yeah, for number 4 is the continuation of the 2026. I made a mistake in the agenda. The 2025 annual report preparation. We are in 2025, 26. So I'll have to make a note that I made an error in the agenda. It is what it is. So that report I put together, and I it added a lot of the Leicester Coalition metrics. They had a nice annual report that they released recently that really tells a nice picture. It's a very, very nicely put together report. And I was like really impressed, and really impressed to see how much Brookfield is, how much services we're obtaining through this grant. So that was nice to see. I tried to keep it almost the same pattern of the previous ones, but it's just been expanded to kind of cover, because we don't really have a good report showing the, who the staff is at Leicester and all the different services that they provided throughout the year. So I combined for the public to know that information along with our metrics as a board.
did we enact the marijuana regulation in 2025 or 2024?
We did that in 2024.
Okay.
That I can verify.
And then, should we make it more clear that, about Mackenzie working for us? on
I
Fridays,
made
or-
a statement that she's contracted,
Yeah.
and I think that's probably enough.
Okay, so,
I don't even know how long, she just had another baby, so I don't know like how much work she actually do. She didn't do any work other than one providing letters out like one time, so I haven't heard from her. So for 2026 probably maybe more
okay.
information.
Gotcha. So
This is
for-
the prior year.
Okay.
I apologize, I made a mistake in the agenda, the digit. need more time, we have more time, and we can address it at the next meeting. And I kind of suggest that we do, since I made a mistake in the agenda, that I'll just defer it to the next agenda, so that we can go and finalize it before the end of the month. That way, the mistake is acknowledged, and we'll address it at the next meeting. If you had any other comments, bring them to that meeting, and we can just review them the way we review minutes.
All right,
So, going back to item 1, the board discussion of Leicester Regional Public Health Coalition administrative support for Brookfield. And then there's the second part of this discussion will be the code enforcement software from Relevant, and I have brought the contract and the copies of it, and I took that out. It's on the clear side, but it's a SaaS, service as a software agreement for software to do inspection services. So I guess the first part of our conversation is to talk about fiscal year 27, which starts on July 1st. And that discussion we started having at our last meeting, I think, about, because we're being asked to fund a portion of the maintenance position at Leicester. And because we only get so much for dollars per year, and because she's extremely efficient in her role, and knows our side of it at this point, the question is to expand her role at Leicester Coalition to include the needed clerk duties that she can't already cover during the week in Leicester, right? So if we're funding Leicester for the clerk duties, she's then able to cover the phones all week long, because they'll just go straight to Leicester. She's able to cover the emails all week long, which is more coverage than we have now. And then the only time she would have to come here is to retrieve documents that have come, process the application payments, and the turnovers for the transfer station, assuming they stay with us. They may change eventually. But the other work would just be filing things that have already been processed by Leicester, and then picking up whatever needs to go back to Leicester for processing. So that solves like a lot of pain points that we've had as a board in having continuity. You know, when we had another agent, they were in here pretty frequently, and she'd pick up the box, but sometimes it would get missed, and it just would make, I think, the permitting process a little more efficient. She'd be the person, just the main point from A to Z on the whole permitting process. No, only this, and, you know, no back and forth, and then just giving us greater coverage. So the reason I wanted this on this agenda is because of the budget, you know, for fiscal year 27, just to make a decision, do we want for beginning in fiscal 2027 to have the Leicester administrative assistant role take on the clerk duties as I just described, in addition to her typical duties. And then what we would do is pay that portion, which I think was about $10,000 that you had. And then we have a little bit more in our budget than 10 that we could still work out to hold back in our budget as needed, if we wanted to say have her attend meetings, if she was open to attending meetings, and pay her directly, or also, you know, whatever the town gives us for budget, because as you know, they ask us to flatline all the salaries, and then they work out what the COLA is, but then it gets approved. But I imagine it's going to be, you know, whatever the usual couple percent difference. But just to flatline that, and just decide as a board that that's the direction we want to move. So I'll open it up for you guys to comment on that. that's an idea that you'd like to move forward to do.
Yeah.
I feel like it's a no-brainer.
Right.
I agree.
Okay.
This is what we was.
So I just want to hear a motion for fiscal year '27 for the Brookfield to fund LRPHC / Leicester, because they're the host town, and they actually go through the town of Leicester.
Yes.
Correct, yeah. For Board of Health clerk duties,
I wanted to give you.
but I want to give you time.
Yes, that's fine. Just
Okay,
because-
we'll make the motion maybe, and then
Go for it.
we'll second it and then open more discussion. Okay, so, let's say that again. Do I hear a motion for fiscal year '27 Board of Health clerk funds to be, or let me think of the wording here, unless you guys have something you want to do. Starting in fiscal year '27, to have the Board of Health contribute its budget for Board of Health clerk to the Leicester Regional Coalition's administrative support position, and have that position include all the Board of Health duties that we've described. Is that, you want me to?
Yes. So moved.
Which one? I'll say it.
You said it. Okay.
And Christina, you second? All right, so now we'll just have discussion and I'll let you.
Sure. So we've been talking in our LRPHC meetings with advisory group about the FY27 budget.
Speak up a little bit, because I don't know if the mic, these mics, I don't think it's
They're
through
not on.
this, but.
Okay. We've been talking about having conversations on the FY27 budget, and the most recent one, and trying to make an overall picture of what that looks like moving forward. So I had created, and actually, I'm gonna have these for you, like a quick breakdown of how the budget looks like, if we were to include all of our staff in, just to be more transparent and everything as an overall area of budget in our side. So at the end of FY26, the coalition will be absorbing 3 positions that are baseline operations for the grant that are currently supported by the contact tracing grant, which that is something that will end ultimately no more in FY26. Those 3 positions will be the part-time regional epidemiologist, the regional public health nurse, and the part-time human health services director. So these 3 positions will be acquired through the Public Health Excellence Grant. And I wanted to bring it up as a whole deficit, because if you can see, there's almost a deficit of about $139,000 if we were to acquire all those 3 staffs. So I wanted to bring more as an overall regional model, and to bring it, how does that affect Brookfield? I know there has been discussions about sharing costs with the admin side, because it does bring a lot of support in terms of what the public health excellence have provided. But there are 3 areas where the regional model provides the most support in Brookfield. As we all know, is the administrative side, but also the Title V support. So Brookfield is one of the towns that has relied on the regional Title V consulting services, and looking at what it would look like moving forward, we may have a very limited funds to cover that position entirely.
That's going to be another conversation today.
Okay.
Because
okay.
we only have the administrative assistant on the agenda.
Okay.
So I can add that to the next agenda.
Sure. Okay.
Just to clarify, so
Sure.
the whole coalition like grant, you're saying is done after 2026?
No.
Oh,
So the public health excellence grant will continue for
okay.
the whole COVID, the contact tracing grant. That's the one that it's got a sunset for FY26, but because under that grant, there's 3 positions that are covered through that grant. The public health excellence grant will have to absorb those positions, because those are like the nursing, it's required for the PhD grant, and the FAC is also a requirement for the PG grant. The human services side of it is, it does a lot of the community service and community outreach. A lot of that aspect is now also part of the public health excellence grant in terms of our goals moving forward. So that's something to obviously look at, and wanting to bring up an overall picture for you all to understand where are we moving forward in our discussions. But nothing has been decided. It's just been more discussions with boards, just for you all to, I know it's a budget season, discussions with us. Okay.
All right, yeah, today we're talking about the administrative assistant. I just put on that our budget that we have isn't affected by that part because we have a revolving account.
Great.
So, for those services, so we can talk about that at our next meeting.
Sure.
And we'll probably have some questions for you guys as well, so the board will take this under consideration. And so for today, just to talk about the administration.
And looking at the breakdown for those services on the second page, I kind of put in the services that LRPHC provided to the town based on the annual report that was provided to towns. So you can see the permit at the cost related to that talking today. I know before I was like, oh, we have an overall budget kind of distribution, but today I finalized those numbers with after the report. So just to give you
Okay. I'll tell you, I mean, we both know on salary right off the bat until they work that through that there's going to be more. But I'll tell you right now, the clerk wages that we have budgeted from the last year are just under 13,000, so not quite what you have listed.
Okay.
But what we could do is refer to our advisory board, the rationale for, and say that, you know, I know you're looking to make your adjustments on the employees here, but in this instance, this would be more of a budgetary issue because it's a two-part thing. It's the clerk position that's covering us for a clerk, but also covering the administrative support that needs contribution as the town in the future. So with that in mind, I think the rationale would be there for us to do that, whether some of that portion ends up coming out of the Board of Health expense budget or something, or, you know,
Makes sense.
we'll have to talk to them.
Yeah.
I'm not saying it's not a go, but like, just flat out clerk wages, I mean, we haven't come near we keep losing clerks. It's really hard to keep people, you know, doing these jobs, and so we actually are really under budget right now. So, and we were under budget last year because we had these huge gaps where we didn't have the support. And so, from a cost standpoint, like the efficiency that she brings and everything else, it's definitely cost effective overall. And I've just got to be able to sit down with them and meet with them to discuss, you know, the difference of why this isn't just simply clerk wages.
Yeah.
And maybe maybe they change how it looks like it's not paid, like maybe they move this from being like a line item here and they move it into another category, either into Board of Health expense or something. I just don't know how that works because I'm not an expert on the municipality budgeting process, but I'll talk to the
I just
people.
wanted, and I just want to bring it overall,
Yeah.
write it down, just for you all to see more. I'm more of a visual person.
Yeah.
And
The only thing I see, you know, looking at the number, I don't think she's compensated enough. I think that just a small increase from year to year, I see some big jumps in some of the others, but I don't think she's compensated enough, especially if she's going to travel to Brookfield once a week. So that's kind of what I was thinking. I'm like, I really want to look at the position from the point of the coalition to say, you know, okay, we're giving you more responsibilities. Let's compensate accordingly so that she had, it's something that, is worthwhile to her.
Yeah, makes sense.
I mean, it's
I
not,
mean, with my.
to me, it is a puny little increase of pay is not worth coming here
Yeah.
every week.
And I know I try to make everybody, even last year, we did do like a jump because we did have the funds, but because we were doing salary, looking at those budgets, increasing any other salaries. When I looked just at the other 27, I did include the COLA increases only that the town provides. Other than that, I mean, I don't have a more,
Like changing her job description.
right. We would have to look into, but I don't, if that based on the item number that we discussed this, when you step out, that might change, so I don't know how that's.
Right, okay.
So,
Random question, how come Lester is so low on the inspections and
because there's
admin
a,
costs?
there's an active agent.
Yeah, they have their own.
Oh, they have their own
staff.
Yeah. So I try to do, in the inspections per town, I just included what, some of the services that are provided to them, but most of them will be Title V in that aspect for inspections.
They've got a McKenzie, but that person works for them like on staff.
They
And
actually
they
have
also,
Holden, for instance.
Holden also has like they have an office and
Yeah.
everything there.
Yeah.
The agent that works full time. Little Brookfield doesn't have those kinds of support, so. But over time, I mean, change, it seems like we're doing a lot of workload here. Some of these others, much smaller town than us, maybe not as much.
Did Holden always have their own?
So,
Since I started, they've had their own equipment. I can't speak with before, but I'm pretty sure we used
I
to
think they
cover
did.
that before. In inspections before, so, yeah.
yeah, they kind of built that empire. It's under the fire safety, like they have a
I
whole
thought
complex.
McKenzie used to go there, it was like one of the biggest.
Yes, it's, I
They
remember
did.
it used to cover, yeah.
Yeah,
But
they
then
definitely come to.
they hired the division director. Yes, so when I started,
Well, yeah, I'll talk to you.
Oh, okay.
I didn't realize.
Okay. All right, does anyone have any more questions about the fiscal 27 plan?
So much. I'll send you a
no,
Thank you.
It's one of the,
Take a vote on that motion.
so it's written, so
All in favor?
it's the
Aye.
portable, it's, so you were you
So that takes care of
Central
that.
Street.
And then we're the software, so
Yeah.
maybe you could give us a brief,
of course.
she's got just a few minutes left,
Yeah.
so we're almost done with the meeting. But
So the relevant software is a
We can do better.
inspectional software that supports food, housing, Title V, however, for MRHC. We're just going to
Sorry.
start with food, we'll look forward how budget-wise and stuff like that.
Okay. Yeah, don't know that
Move
that's-
forward, but we're starting with food at the moment, because it's also one of our goals to have a standard inspection, so that way it's the same throughout the coalition. And it's a lot of, it saves a lot of time. It's like paperwork, it's very efficient reading exactly the code, citing things properly in the regulation, so it's a really standard, operational inspectional side that we can provide to towns. And nothing really will come to towns, but it'll cover through,
Yeah, let me know, just so the,
and
So,
nothing will be, I mean, again, towns will not be covering any of the services, they will cover the expense grant. But yes, it's really, I mean, the short service of SAS, it's really straightforward in terms of what are the services that they'll be providing. The town's role is just to maintaining, obviously, the accounts for the services. If I remember correctly, I know this, I know for having this part of admin access to it, because then the regional inspectors will have access to, obviously, the Brookfield. And the way they set up their report is everything has, or the header is Brookfield. And that's inspectional form, even for the order to correct letters issued for the correct the Brookfield side, or the town side, town level. So one thing that includes, a part of that is to also send the logo, the town seal logo to them as well. So
That's easy.
easy, but the signature will be,
When do you need this done? When do you need this done?
the sooner the better.
Okay.
Yes.
I would want just to have our town council review the contract before we sign, but I'd entertain a motion to allow us to sign the contract following KP's input.
Well, I think they really started.
If anyone wants to do that.
And it says this goes into effect July
For next fiscal year, yeah. So we have a little time, but I'd like to, I don't want to just sign a contract with the town without KP giving it a once-over. So, but if you want to make a motion, either to defer to the next meeting, and I'll get the review from KP, and then we can, if they have feedback, just bring them on to the agenda again.
Yeah.
Is that preferred?
Yeah.
That'd be fine with me.
So,
Is this part of this technology hardware? Okay. Makes sense.
It's just to allow the. All right, so any other discussion on the agreement?
Yeah.
All in favor? Aye. All that's left is the budget, and it's like transfer station, but if you have to leave, let me know. But it's- I can try to be very quick, because I think we got most of it done. Okay, so, thank you for the first update. And so this is the worksheet that we were given. The salaries, we don't have to worry about because they told us to level that, so for the town. We have a revolving account now, so we don't have an agent line. We have a revolving account that pays for agents and engineers and all that. The animal inspector, level that, level Board of Health stipend, Board of Health expenses. We're about halfway through the year, we're about halfway through expenses, I would level that. And transfer station wages, we just rely on the town. The well test, we've still got one more year in our contract at the same cost, we can level that. And transfer station expenses, so this is the one that was kind of weird to me, because when I go through our ledger, which only just says what comes in for transfer station income, it doesn't take into account all the crazy stuff that poor Lori has to do with as an accountant, right? Like, because some things go in different places, but so we have expended, oh my God, 95,000 or so of our budget that began with like 138, or I'm sorry, 89, sorry, I was in the wrong column. $89,000 is what has come in billed. I mean, we've taken in nearly $100,000 in income for the transfer station at this point. So from that perspective, it looks good. The problem here is that the transfer station income now tapers off, right? Once we get all the people to get their stickers, a lot of that income that we get a bulk of it in the months of like August and September, and even a little bit trickling into like October. Everybody gets their stickers, so now we're not really selling stickers at this point.
Yeah.
It's just a trash usage, and sometimes it's very high and sometimes it's low. Casella keeps increasing their cost per ton, so I think we're just over $100 a ton now. That contract and pricing structure goes through another year. The spreadsheet that we were given looks like we're on the low side for spend. it says, you know, she's only got, there's like a $40,000 difference, and she gave me this spreadsheet that I was trying to use to understand where that came from, and now I just gotta get all my papers. Morning meeting, I'll get this always happens. Sample here. All right, so this. This, now, I couldn't make sense. She tried to give me a ledger history so I could compare each warrant that came in with like how much was processed. I have to talk to her again about this. This made no sense. Like, for instance, the Highliners example of the invoice, you know, she put $551. That's an $8,664 bill. I'm assuming a portion of this was paid through our grant money that we get from the Sustainable Recovery grant, right? So I'm assuming she applied grant funds to that. I just have to verify. So that would kind of knock off like some of that, like why her total is less. And so I think there's probably a few examples in there. I think there was probably another example, the solid waste invoice that arrived to us like on July 1st. Right, and we have to do like an encumbrance thing, and so it may have been processed by the clerk as coming in July and the warrant number 1, or you know, but it was actually encumbered for last year. So we have these kinds of things that makes the math a little more tricky, but I think we're still in good shape with the budget that we have. Despite the costs. We did actions throughout the year to increase a few prices of things at the transfer station based on those little contracts of price increases to kind of offset. So like we signed the one on the batteries, and we've got, now we're actually getting paid for scrap metal. So we're getting a little income from that instead of not getting anything. We get a little income from the textiles. So the way I look at it, it's about fine where we are. We always had a little extra added in to cover costs if we have like an emergency issue, electrical issue. We also had an invoice, and I think that's probably one of them. And we've got invoice from I think the highway department for some drainage work that they did, and perhaps she said, well, no, that probably comes through another department. We added in this transport station expense, but it probably, when she was doing it, probably like, no, that's in a different account, and she pulls it from the account. So that's kind of the thing that I think is happening as to why those two numbers are a little different. But at the end of the day, I just think that, you know, I took a good look at it. I think we're still in good shape in terms of we're bringing in about the money that's going out. It's going to be a little touch and go for the next couple of months, but I didn't see the increases at Casella so high that we can't cover that buffer that we have. We also got some grant money for sheds and things that we were trying to budget for in this budget, and now we have those grants, and so those grants will help pay for some. I think it's like $11,000, and we got another like $4,000 on the grant points last year. So that money coming in helps also offset any of that. So I think we're in good shape. So we can recommend to the advisory board, you know, sort of a flat, and then we'll be having more conversations with them. And as that time goes on, we'll probably have better data coming to us. And so when we have those advisory board meetings with, you know, to talk about our budget, then we can update, you know, that, you know, they can make the adjustments based on the data. But this is our recommendation at this point, is just a flat line. And at least in my view, if you do agree with that.
Yeah.
Okay. Yeah, the two, I guess the motion would be to maintain the fiscal year 26 funding into fiscal year 27. Thank you. Thank you. Any further discussion? All in favor? All right, motion to adjourn.
I'll make a motion to adjourn at.
Nice to meet you.
Nice to meet you too.
Second.
All in favor?
Favor?